Welcome to another chapter. This time we're gonna be reading the chapter 21. Today's called gynecology. Okay, let's start. The female reproductive system. We got the womb, the fallopian tubes, the ovary, the neck of the womb or cervix, and the vagina. Okay, the menstruation. A period is a common name for a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes. LMP means the last menstrual period was 2 weeks ago. Um, the menstrual cycle, or length and frequency of periods, is usually written in the form 4 slash 80 20 which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term, the term heavy periods means excessive blood loss. Menorrhagia, often with a passage of clots, coagulate bloods, and the term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating normally about the age of 50 is called the menopause of climacteric. In everyday English, it is known as the change of life or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of head and night sweats. C. A gynecologist consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist, are you regular? Are your periods regular? And the patient say, yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12? When was your last period? A week ago. How long do your periods last usually? Like 4 or 5 days. Will you say they are light or heavy? Light, said the patient. Do you get clouds? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. And what color it is? And the patient said, white. D. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, EU, or couple coil. Condoms are available for both men and women. Okay, so now it's time to translate it. Ginecología. El sistema reproductor femenino. Tenemos, como ya dije, las partes, tenemos el útero, la trompa de falopio, los ovarios, la vagina y el cuello uterino. B. La menstruación. La menstruación. Un periodo, perdón, un periodo es el nombre común para la menstruación mensual. El inicio de la menstruación se conoce como menarquia. La fecha del último periodo menstrual se suele indicar en las notas médicas. Puede hace significa que el último periodo menstrual fue hace 2 semanas. El ciclo menstrual, duración y frecuencia de los periodos se suele escribir en la forma 428, lo que significa que dura 4 días y ocurre cada 28 días. Si el periodo dura más de 4 o 5 días, se puede describir como prolongado. El término periodos abundantes significa sangrado excesivo o también se le llama menorrea. A menudo, con la expulsión de coágulos, sangre coagulada, el término dolores menstruales significa dismenorreas o menstruación dolorosa. Al momento en que una mujer deja de menstruar, normalmente alrededor de los 50, se llama menopausia o climaterio. En inglés cotidiano se conoce como el cambio de vida o simplemente el cambio. En inglés cotidiano se conoce como, perdón. Los síntomas de la menopausia incluyen sofoco, sensación repentina de calor y sudores nocturnos. Consulta ginecológica. Un ginecólogo está hablando con una mujer de 30 años. Ginecólogo dice, ¿sus menstruaciones son regulares? La paciente dice, sí. ¿Con qué frecuencia las tiene? Cada 4 semanas. ¿Qué edad tenía cuando empezó a tenerlas? Aproximadamente 12. ¿Cuánto suelen durar sus menstruaciones? 4 o 5 días. ¿Dirías que son ligeras o abundantes? Ligeras. ¿Tienes coágulos? No. ¿Tienes dolores menstruales? No realmente. ¿Hay algún flujo entre las menstruaciones? Un poco. ¿De qué color es? Blanco. de anticoncepción. Para las mujeres, sus métodos para prevenir el embarazo incluyen la píldora anticonceptiva oral conocida como la píldora, el diafragma, el dispositivo intrauterino, DIU o espiral de cobre. Los condones están disponibles tanto para hombres como para mujeres. Okay, now it's time to read the exercises just in English. Okay, the first one is the 21.1. Write a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. The one is hysterectomy, that it means surgical removal of the womb. Two, menorrhagia, heavy periods, and salpingitis is inflammation of one of the tubes that connect the ovary of the womb. Third, cervical biopsy, a small piece of tissue removed from the neck of the womb. 21.2. Read the conversation between the gynecology and the patient in CO positive and complete the notes about the patient. Menarche, 12 years. Menstrual cycle is 4 or 5, about 28. LMP is 1, 2, sorry, no, ago. Menorrhagia, no. Dysmenorrhagia, no. Discharge, a little white discharge. Okay. 21.3. Now write the questions that the doctor asked. Look at CO positive to help you. Menarche, how old were you when you started to get your period? Menstrual cycle, how long do the period last usually? LMP, when was your last period? Menorrhagia, will you say they are light or heavy? Dysmenorrhea, do you get period pains? Discharge, is there any discharge between the periods? Okay, now it's 21.4. Complete the case report. One word is needed twice. Look at B and see a positive to help you. Case fighting. Uh, a 45 years old woman has been having heavy periods lasting for 80 days, 8 days. With the passage of two clubs for 9 months, there was no bleeding between periods or after intercourse. Her periods were not particularly painful. She has not noticed any hot flushes or night sweats, and urinal hair had always been good. She has like she had taken the oral contraceptive pills until a year previously, when a copper coil was filled that she had a normal pregnancy when she was 25. So we got a diagram, a iode, the condoms, and the copper coil. So that was all for this. You need. Thank you. See you. Miss you need.